Cek. Yang baru datang silakan langsung duduk di paling depan. Mbak siapa namanya? Yuk, 3 orang langsung duduk di paling depan. Kaji ya. Cek. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Ladies and gentlemen, today's class is going to start. So please be prepared. Please to all participants to mute the cell phone and gadget during this activity. Assalamualaikum warahmatullahi wabarakatuh. Good morning, ladies and gentlemen. Welcome to the Hall Baroroh, Universitas Aisyah Yogyakarta. Ladies and gentlemen, we're delighted to welcome you to the expert class or Studium General, Concept of Grief, Loss, Death, and Care After Death. Let me introduce myself. My name is Astriana Murnistiawati. I'm the Master of Ceremony as well as the moderator for today's activity. And it is an honor for me to introduce myself and welcome you. Especially would like to express our sincere gratitude to Honorable, the speaker from University Malaysia Sarawak, Unimas, Associate Professor Dr. Aini Fahriza binti Ibrahim. Honorable all lecturer and staff of Nursing Program, Nursing Profession Program, Faculty of Health Sciences, Universitas Aisyah Yogyakarta. Last but not least, all the participants of the expert class or Studium General from semester 2, class A, B, C, and D, and also semester 6, class D, we welcome you. Before moving on the next session, let me tell you the rundown for today's activity. The first is a Quran recitation, followed by lecture by the guest speaker, and then continue with discussion. After that, we will hand over the appreciation certificate and also photo session, and the last is closing. So, well, let's begin this program by reciting Basmalah together. Bismillahirrahmanirrahim. Next session is Quran recitation that will be recited by Ananda Royhan, Surah Al-Mujadalah, verse 11. Time is yours.
Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
A'udzu billahi minasyaitonir rajim. Ya ayyuhalladzina amanu idza qila lakum tafassahu fil majalis إذا قيل لكم تفسحوا في المجالس فافسحوا يفسح الله لكم وإذا قيل انشزوا فانشزوا يرفع الله الذين آمنوا منكم والذين أوتوا العلم درجات والله بما تعملون خبير صدق الله العظيم. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you, Mas Raihan. We are now continuing to the next session. Finally, we arrive at the main session of our meeting today, the lecture about concept of grief, loss, death, and care after death. We will be guided by me as moderator to listen about the lecture and discuss more in the question and answer session. And moving right along, it is now my pleasure to introduce our guest speaker. She is Associate Professor Dr. Aini Fahriza binti Ibrahim, and she is nationality Malaysian. She's worked in University Sarawak, Malaysia, UNIMAS, and she worked in various research about palliative care. So it is very expert in palliative. So everyone can ask the question in the asking and question session later on. And a lot of curriculum vitae about Dr. Aini, and I think if I read one by one, we will lose our time. So I think right now we will welcome Dr. Aini to the main stage. So please, Dr. Aini, how are you?
Very good morning. Thank you, Ibu Isrina. So thank you so much for the invitation. This is my first time doing this with university in Indonesia, and it's good that the topic will be in English because I know despite we are Malay-based medium, but most of my topics, most of my specialties are English-based. All right. So I hope the words that I use. Am I to know that in your university, the teaching are all in English or is in Bahasa Indonesia?
Yeah, maybe we can mix because we have 3 students from Libya. So yeah.
Oh, okay, from Libya as well. How many students do you have?
Around 230.
All right. So some are from overseas as well.
Yes.
Okay. Right. So what the topic that I'm going to talk about today is a quite heavy topic. It's something that we deal in everyday day-to-day life, not just in our profession, but also on our daily living. So my slides are based on lots of reference from the internet, from other people's presentation. But I think this is more of simpler way of trying to combine all the topics together. I'm trying to cut it short. I'm not going to talk the whole two hours because people normally after lecture 30 minutes people will definitely try to go to sleep or try not to focus so much more. Okay, can you hear me well?
Yes.
Okay, right. So I just share my screen. Okay, can you see this?
Yes. We can
Okay,
see.
right. So just as simple presentation. One second. Okay, all right. So when the topic was given to me in terms of the concept of grief, loss, death, and care after death, I don't deal with lots of patients with who I mean, after death, because most of them are being, once they pass on, they are being, back home or whatnot. But certainly, because of my work in colorectal surgery, I deal with loss of grief and also loss of patient who died because of the cancer. Okay, again, my name is Aini. I'm one of the professors from University of Malaysia, Sarawak. I think some of you came to my university last year in December. We had some CSR program with Apnema, right? Now, so I deal lots and lots on patient with cancer. As you know, cancer, or in Bahasa Indonesia they call it kanker or tumor, is one of the most detrimental case that currently there's no treatment that cures all, right? There are multiple types of cancers. The most common one that I deal with is colorectal cancers. When I say colorectal cancer, is the large bowel and the small bowel as well. And most of the cases are very complex. As you know, the prognosis, if cancer is detected at later age, it will be much more worse than early age. So now we are advocating for people to have early screening in Malaysia to detect this cancer before it becomes advanced stage. Okay. Now, all right. So I quote some of the words. Sorry, the thing is not. It's not. So once you are being told about a bad news, all right. So the first thing you will feel is grief, right? Of course, it's not a disorder, but it's actually a disease. It's emotional and physical necessity. And then this is because, for example, the family members, this is the price they pay for the loved ones, and they grieve because it's part of the normal physiological thing that we go through. All right. So grief, what is grief? It comes like in the ocean. It comes in wave. It comes up and down, and then sometimes it's calm, and sometimes it's overwhelming. And then sometimes what we need to do, we just need to learn to go through it. So what they say about swim and go through it, whatever the situations are. All right. Whereby when we talk about loss, all right, loss is anything that perceived by individual throughout our life from birth to death. We have suffered losses. I'm sure most of you have, isn't it? I mean, you pass, your parents, your grandparents pass on. Relationship, or even your animals. They are form of loss, multiple form.
Could you please more slowly, because some of our is it's too fast.
Okay, sorry. Yeah. So
you.
yeah, sorry, because yeah, sometimes when you keep on talking, you don't really know that you're talking very fast, especially in the word that I use normally. Okay, we'll go back again. Okay, loss is very common. All right, it's a universal phenomenon. Everybody has it, and then it's different from different individuals, isn't it? I'm sure. I think all of you have suffered loss before. Maybe you can raise up your hand. Angkat tangan. Siapa pernah? I'm sure everybody suffered loss before, right? Okay. So when they define loss, it's actually the experience of parting with a person, an object, some belief or relationship, right? This object may be animate, maybe something living, or inanimate something non-living. Or it could be a situation, or it could be a failure of something that you perceive. So it's a very universal word. We could say loss means you don't have really like one particular definition of loss as much, right? But it's more of the feeling of all the experience that somebody is parting from you. Okay, right. So what are the types of loss? This is based on the research from the palliative care, based on the topic that they have found out in terms of types of loss and types of grief that we go through. So what is actual loss? Actual loss is actually something you recognize, I recognize, and everybody understands everybody sees the loss. For example, somebody died, right? In Malaysia last time we had our two airlines, MH70 and 370, when got lost or got torn down. So that's very actual loss. We can see it definitely in front of our own eyes, all right? Whereby the perceived loss is what you feel to yourself, not felt by others. So this is definitely when you have a failed relationship, you're divorced, you're being left by your loved ones, all right? This is something that you feel, all right? How about physical loss? Physical loss is something, for example, what we see in hospitals. You had amputation, you had something removed from the body, you had your organs removed from your eyes, all right? So this is a physical loss because you have something that you see and is being taken away. Physiological loss, all right, this is a bit more vague because it's mostly because of the body input rather than the feeling emotion. And anticipatory loss, meaning that we anticipate, we think that's going to happen. So we should, even though it's not going to happen, it hasn't happened yet, right? But you already know that's going to happen. So this is where you see in lots of family members in palliative care for patient. For example, for my patient who has a cancer type 4, advanced cancer, who has no other treatment, they experience this kind of loss normally, all right? So they actually put this category of loss into 4 major category. First is the loss of aspect of self, you yourself, all right? A feeling inside. Number 2, loss of others. Number 3, loss of external objects, and a loss of familiar environment. All right. As you can see, if you see the presentation, they have many definitions of different people, different psychologists comes up with different types of categories and types of loss normally. All right. So that one is we talk about loss. Whereby when we talk about grief, right? Grief is a pattern of psychological and physical experiencing after the loss of significant others, objects or relationship. This is how you perceive, how you behave, how you show emotion, how you feel inside. All right. The loss is the first thing that happens, and then the grief is what you feel afterwards. All right. Whereby when in grief you can't run away from the topic of bereavement, which is the state of desolation occurs as because of a particular death of significant other. This is kalau bahasa Indonesia ada berkabung ya. Rasanya berkabung ya, berkabung. Bahasa Malaysia pun dia katakan berkabung. Jadi so different societies, different religions have different definitions of grief or bereavement or berkabung, right? Same as mourning. Mourning is actually the act of doing bereavement. So it's a socially prescribed behavior, and it varies with culture. And then the period of acceptance of loss and grief during which the person deal with the loss. Meaning you have this, some people have, I'm not sure if in Malaysia we have the Chinese people, they have sort of mourning for maybe like 1 week or 2 weeks or whatnot, but it is all varies, right? So this is the time where they try to not to do anything in terms of affecting the emotions of the family members, right? Everybody knows this kind, bereavement and mourning. Okay, now, so when you talk about grief, okay, so this is again, because there's so many research about grief. We thought the grief was just one word, right? We just thought, okay, loss, grief, that's it, all right? But they actually did multiple research on it. They put and divided into different types, okay? Either normal grief, anticipatory grief, you perceive it. Disenfranchised, this one I will not touch, and dysfunctional I will not touch because it's very complicated. This is like a psychological topic, all right? So we just talk about the normal grief that we go through, okay? So one of the famous writer of psychologist, her name, I'll show you face later on, she proposed a term of uncomplicated grief to to reaction of grief just following a significant loss, all right? Whereby anticipatory grief, which is the grief happens before the expected loss, all right? Maybe this is actually a coping mechanism, right? We think it's going to happen, the loss is going to happen, all right? So we grieve before that, all right? So that, you know, at the end, when you go to the stage whereby you have to accept the whole scenario, so you're not going to be much more involved, all right? Delayed grief, this also happens. Some people, because they don't accept the situation, they sort of like in denial, and they have this delayed or uninhibited grief, right? You don't want, I can't accept, no, this is not happening, all right? And sometimes this could be pathological. And what we see, the people sometimes, you know, they feel numb, they don't feel any pain, they don't feel any emotion, but actually they could have underlying disorders or some anxiety or sleep disorders, all right? And then this one is exaggerated, meaning that you grieve more than what you normally do. Normally you can be angry, you feel hopeless, powerless, right? That can happen as well, right? So this is all accepted type of grief that happens in lots of people in the world, right? Now, how about a chronic or prolonged grief? This sometimes can go on years after years, all right? People say that, you know, time will heal, right, to people, but, you know, that's not always the case, right? Some people heal faster, some people heal longer, so some people could have a prolonged grief, all right? And then sometimes the worst part that, you know, this grieving period will affect their normal activities and sometimes their life as well. Okay, now, so mask grief, mask meaning that you try to cover it, all right, even though it happens. So you have some behavior that as if that it doesn't happen, right? So you try not, because it's same as denial. You don't want it to accept the problem, and then you do other behaviors to sort of cover up your grief, all right? For example, you became very angry person, all right? You become irritable, you know, you're no longer the person that you are before, all right? Okay, what are the factors that can lead to all this grief and loss, all right? Of course, death is a big thing. We will talk about that later. For example, the one that's very vulnerable is the death of our child, our spouse, death of our parents, definitely, or death that is very sudden and unexpected death, isn't it? You know, for example, accidents or a heart attack or whatnot, right? As well as multiple death, you know, because we have some people, somebody within 1 week, they had like few of their family members die, all right? This is certainly becomes vulnerable to the patients. Others are death by suicide. We don't see so much of this here, suicide or murder. And the rest, I mean, this is the type of the vulnerable factors. Okay, now this is the famous one. I think when we were talking about how to cope with all these scenarios, you know, we have the stages of acceptance, the stages that we go through during this loss, grief, and death, and care after death, right? First of all, it's always denial, right? I mean, unless this is a chronic kind of problem that, you know, you anticipate that the death, the loss is going to happen, then you might not have the denial. But mind you that everybody will have some sort of denial in case any loss or death happens in the situation. So you feel numb. You don't feel, you say much, oh, is this really happening, right? No, this is not. Maybe this is it's a nightmare, or maybe this is just a dream, all right? So you try to deny it as much as possible until at one point it strikes you that's actually happening, all right? And then some people, number two, develop anger. They say, why this is happening? Why me? Why happening to me? And then they become anger. They internally or externally, they become totally emotionally different than what they are normally, right? So they just want to vent what they feel inside, right? And then after that, bargaining is a new term, all right? It is in between whether you want to accept that, all right, or you want to go into a psychological problem. And then this is when people goes into depression because of the loss. Somewhere, somehow, we definitely go into depression in terms of your mood's gonna go down, you're gonna feel so sad, your life is, you feel that's the end of your life, all right? So, and then you starting to have depression symptoms, you can't sleep or whatnot, right? And then how long does it go through? It depends on the individual. And then last but not least, which is the acceptance. This is when, later on things become back to normal, right? So this is the famous writer who talks about death and dying. And then she was the one who identified the emotions, all right? So initially when we were taught, it was more of denial, anger, and acceptance. And then the other two are more additional type of it, all right? Because the three main ones are more of what we actually gone through in our life, but we never realized that it's actually that process. Is everything clear, Dr. Ibu Asrina? Anything that too fast again?
Yes, everything is clear, Dr. Aini.
Okay. All right. Just stop me again if I get too fast. All right.
Yeah.
I'm trying to relate all this topic to own individual, right? And definitely this is much more understandable if we experience this ourselves. All right. So again, go back to the stages: the denial, anger, bargain, depression, and acceptance. All right. In Malaysia, especially in the Muslim family, we don't. I mean, we were taught not to use the word depression. Depression is something that is more of a Western world kind of word. All right. In our society, we think this is more like a taboo, or we don't think it's a part of our. We shouldn't have a depression in terms of we have a coping mechanism in terms of the religious part of it. All right. Okay, so when they started doing this, actually it's for patients. All of this started with patients, right? And then later on, then they realized that, oh, this concept also happens in day-to-day life, right? In your job, in your workplace, right? In your personal living, right? This term can also be used for example, in your patient with having a problem with family, drug addiction or whatnot. So all of this problematic situation, you can use the same concept, all right? Okay, so we go through one by one. Again, what's denial? Something you don't totally against it. Okay, no, it can't be true. It's just not possible, all right? Actually, it's actually a protective mechanism, all right? Because you think it is help with coping, all right? And maybe this is the first one happens, maybe the 1 or 2 days, or it can be even months, right? But this should be short term, right? Denial shouldn't be long, right? This is how we notice. You can't have, because if you have a prolonged denial period, you can't move on with the next stage of grievance and acceptance, right? Now, anger. So once you go into this stage, all right, you try to blame. This is what we call blaming effect, all right? Whether you are blaming it towards somebody else, all right? Some people, blame it towards the God. Some people blame it to the self, or some people blame it to environment or to the society or whatnot, right? They just want to have what we call some stepping stone, right? To vent their anger so that they don't feel it's just by themselves, right? Then anger. And then again, this period, how long does it take? Varies, all right? It can varies from one after another. Then bargaining. Sometimes this is when when they talk about this, is when you try to ask for different situation, all right? Whether you want to maybe in Islam this is not right, but you try to sort of prolong or give and take about the situation, all right? But this is not right. I mean, if it's gonna happen, it's not there, you know, it happens, all right? So that's why, because this new concept is new, right? The bargaining and the depression. Depression, of course, this is, I'm sure you guys seen through this, you know, the worst part of the depression is people, I mean, in the third world, in the other world, they, you know, in Western world, you know, they cope by drinking, having fun, you know, taking drugs, all right? Some people here, they keep on eating, all right? Binging, all right? So this is actually signs of depression, because you are coping to, you're at the stages of the grievance, all right? And this is when the lots of complications can happen, all right? Even accidents or whatnot, right? And then this period can be early, can be long, prolonged, all right? Can be chronic, all right? We see lots, I think in the world, we see lots of the chronic ones because of they can't accept the loss or the things, the death in the family, right? And this one, yes, time will heal again, but it still can be prolonged. Okay, this is the final stage, right? It's easier said than done, all right? We can accept, all right, because we feel that closure. You want to have the final stage whereby we feel peace, we feel you put a stop towards it, all right? So because you want to move on, all right? But again, not many people go through this, all right? So we hope, you know, we try to assist patients towards the end, they can accept that, all right? But this is not easy, right? This is not easy. And certainly if I talk about my professions, I don't even go into this stage normally. It's normally done by acceptance of people that, you know, surroundings you, your community, people that is close to you, right? Because once we have detached the patient from our field, right, our work of place, we, you know, it's they themselves with their family and their friends, all right. So as I said, it's more personal, and it's more towards the society kind of thing. So what they also detect, some of the books, they try to differentiate between grief and symptoms of clinical depression. Okay, but I think it's more towards for the psychologists to detect, because you know, depression is a disease, right? People have to give medication for depression. So you have to know the boundary between grief and depression. Okay. All right, so this is another concept that they use, all right, dimensions of grief. This is when they wanted, I think one of the psychologists again has noted that process of grief is multifaceted. What this means is multiple areas, right? Multi dimensions, right? So they can have the emotional response, they can have the physical sensations, the altered conditions, cognitions, and behavioral response. All right. Again, this is very, very detailed, right? But as long as you know, there are those kind of dimensions. Okay. So what are normal signs of grieving? Okay. Sometimes, you know, we think about the person and then we talk the way that the person talk, all right? The way how the person acts, all right? Sometimes we mimics what they do normally, right? Sometimes again, you say in denial, just say to yourself or say to person, no, that's not true. So that doesn't happen, right? You can you phrase it to yourself, right? And then you feel this emptiness syndrome, right? The feeling of emptiness in the body, in the heart, right? In general as well. restless. You can't, you do not know what to do. You can't, you sit down and you have to get up. You want to go up, but you don't want to eat. So it's very restless. I'm not sure what's the Indonesian word for it. If in Malaysia we call it mandi tak basah. I can't remember that. Is my BM is my Malaysian word is not that great, but basically you feel that something is not right, right? Whatever you do, okay. So you feel this heaviness in chest. Is again right? The same as this emptiness. You feel your heart is palpitation. You feel that something is pressing on it. All right.
We call
And
gelisah in Indonesia.
gelisah, gelisah. Yeah, but this one is more like gelisah to the max, all right? Then well, the worst part is you're unable to complete your work. This is when people get started to have medical certificate, MC, cuti from work, because they just not themselves, all right? And this sometimes affected the people's performance. And you can't concentrate, I have students, because I work in university where I have medical students, all right? So we are given students to lecturer ratio. So I will take care maybe of like 7 students, and then I will monitor in terms of their progress. So year 1, they perform very well, they pass. Year 2, and I have this one particular student, top scorer, gold medalist, all right? Suddenly in year 3, suddenly she failed totally. And then we know that this is not her, something might have happened, all right? So, and then when you talk back to her, yes, she suffered a very deep loss in her life during the exam, right? And so the first exam she couldn't make it, and then it prolonged throughout that 1 year. So she had to repeat the whole 1 year because of that. And she's unable to work like normal person what she was before, right? This is very sad because we know that this is a good students, right? And it happens, right? Lost appetite, or sometimes people have increase of appetite. They binge, they keep on makan ice cream, makan chocolate or whatnot, because they want to think differently, right? Now, what are the normal signs of grieving? Okay, mood swings. Okay, again, sometimes you feel happy, sometimes you feel angry, sometimes you feel guilt. All right, and then sometimes when you have especially kids, when they lost their mother or their father, the other person or the spouse will feel the obligation to take care of others and protect them. So you feel much more overwhelmed. And this is common, right? This is common. And so that if they feel they are going to be the protector, so they feel they have a purpose in life. So there's actually slightly a show of grief, right? Then sometimes you always remember all the stories about your loved one, right? You feel and you sense the presence of the loved one, a person that you lost, or person of even not just person, even cat. Sometimes you feel some sort of hallucination, right? And sometimes you have sleep disruption and insomnia, and bursts of crying, all this. People say, oh, gila kan, suddenly just cried or whatnot. But this is all part of grieving, isn't it? And the worst part is sometimes you just feel aimless. You walk around, all right? You drive around, all right? You feel, for example, people travel around so that they feel that if they're away from the place that they used to be with the person, with the family or the loved ones, they feel better, right? But actually not, and then they feel much more empty. Okay, now, so as I mentioned, when does it finish? Right, the recovery period can vary very widely. Right, some people months, some people years, some people years and years. Right, there's no I think there are going to be more research in it, okay, to see what are the things that you can do to help to reduce the recovery period, okay? Okay, so I forgot my this response. Okay, how do people, women and men, differs in terms of grieving purpose, all right? Women, we like to talk, all right? So we try not to keep it to themselves, and we like to express it, all right? Whereby for the men, they are mostly likely to keep it to themselves, because maybe because of the ego or whatnot, right? And they feel that, if they speak up, it doesn't show the signs of manhood to them, right? So but this why sometimes they suffer more, right? Because they just keep it inside them, right? Okay, so what we can do, okay, what the doctors can do, what nurses can do, what any normal people can do, all right? So first of all, you try to look for people that is caring enough for you, all right, for you or for the person, all right? So these people are normally their family members, all right? Definitely then express your feelings, express what's the problem with how you feel, all right? About the situation, all right, and as well advise on them to take care of good health normally. All right, again, this is easier said than done. And then lots of reassurance, that this is part of death and life is part of the living, right? And then if you have something major going on, if the person that is grieving have some major things going on, right? Try to postpone it. Try to not have decide ruthlessly, meaning that give her time to heal, right? And be patient because time will heal again, and then try to seek outside help. This is when the psychologist or psychiatrist can help in terms of coping mechanism. All right. Now, the main thing is to listen to the people, right? And you want to help the person. It's not about you. When this loss or grief happens, it's not about you. It's about the person, right? Some people don't want to talk. If you don't try to force them to talk to you, right? Whatever they want to tell you, okay, listen, all right? Just agree with them, all right? Don't try to sort of like mingle the stories, add on to the stories, and then try to make it worse or make it much more sad for the person, right? Just listen. Listen is a very good things. I mean, good listening is a very good what do you call it? It's not a job, right? It's just listen, meaning like just you don't do anything, just listen, right? Then can you give support? Yes, depends on what support. All right. Some people, they don't want to be lonely. They want to keep in touch with people. All right. Some people might need support in terms of economic support. Some people need support in terms of religious support. All right. Whatever support that they can that you can give depends on the situation. Do provide that. All right. You can help that. Okay. So what are the warning signs? What are who are the people that we have to worry for? All right. The people who could not accept the whole scenario. So, for example, people who had difficulty in functioning in daily life, right? That they used, like my students, she was a very good student, and definitely suddenly this happened, something had grieved her very much, right? And then look out for people who talks about that. They don't want to live anymore, right? They can even try to commit suicide, right? This is something that very dangerous. And then people that because of the denial and the anger, and then they want to be bitter, or they don't want to feel the feeling inside them, so they become much more angry and much more bitter, so that they feel they in becoming more angry, so that the feeling will be numb inside, right? People who are totally not neglecting their hygiene, you can people somebody who doesn't take a bath, doesn't go to shower, right? Some people who doesn't enjoy their life, even though you give them the best of life, right? They still can enjoy. People who hallucinate, they said, oh, they get up and they see things that shouldn't be seen every single day, right? And then they try to withdraw from others. They try to be isolated, right? This is signs of depression as well, isn't it? And then last, of course, the thought of suicide, all right? Okay, all right. So again, how do you can help? Okay, you can be the one who takes the initiative. Okay, you can do practical things. Okay, simple things. All right. Here, if you have a funeral, we have here in Malaysia. Sometimes we have a 7 days funeral. We can help them in terms of providing the food, providing the place, or whatnot. All right. You can talk to stay with them if they need companion. You help them in the daily chores of life, cleaning laundry, and help their kids, all right? And then just accompany them, all right? So being lonely, being alone if you're grief is very bad, because then you're starting to have these hallucinations and whatnot. So it's better to have people around you. Okay? Okay, last topic today, death. Okay. I know this is a very, very big this is topic that nobody wants to talk about, right? Death basically is the ultimate loss, right? Because if you lost someone, you might, or because of you break off or whatnot, you're divorced, you might have the chance to get them back, right? But death is totally different, right? Death is something that you're gonna have a permanent loss. So again, Elizabeth had a good book about this. Then they also have theories in terms of how you deal with life's end. All right. So they give a very good diagram. All right. First, remember we had the stages of denial. Then we have anger. We have bargaining, depression, and acceptance. And then towards the end, this is the step that we stages that we go through towards that, is what she said. All right. Now, again, it just goes back to grieving. Okay, what are the factors leading to difficult grieving? Actually, multiple factors. I think this is just gist of it. All right, multiple factors. All right, people grieve differently. I think you can't. Somebody at the age of 70 or somebody age 60, 20, they have different factors that leads to difficult grieving, right? So this is some of it I mentioned. Okay. So again, besides you facilitate the grieving process, you can facilitate the mourning process. Okay. So again, this is all about support, right? Being with people, give time, all right? Give your ear to listen, all right? And then try to detect what are the signs of ineffective or coping or effective or signs that danger signs of grieving, and then you can help them before it become much worse, especially if you try to commit suicide, right? Okay, so normal people like us, we normally in general, our life, or in our profession, we observe and listen to lots of problems, all right? Not just the patients, ourselves, all right? So people with this process, they will just need somebody to listen and be next to them, all right? And then assess what they are thinking, okay? We can try to assess how the person is feeling, all right? And then also assess in terms of their spiritual values, because some, like us here in Malaysia, we have the Chinese, we have the Indians, we have the Malays, the Christians, right? So their beliefs are different, right? So we assist in terms of what they want, right? I know sometimes my patients, at the end of the death, the family member wants to have their sort of special things next to the patient, or next underneath their bed before they die. We assist that, because in this they can help to go through the that situation. All right. And then also detect what are happening in the person's body and the attitude, right? And when I say all this assessment, this is very very major topic, right? But whatever it is, it's more about spending your time, spending your heart, spending your whatever you have with the patients to cope in terms of the grief and death, right? Sometimes, okay, if you want to be realistic about it, right? People do have some goal and expectation, but some people like Muslim, we accept if it happens, we know it's not there, right? But some people, you'd be surprised, they want to have goals. Like they want to say, okay, look, my father is stage 4 cancer. I want to know, okay, how long he's gonna live, all right? how what are we expecting, in terms of, is he going to having pain all over his body or whatnot. They want something very physical to help them with the grieving process or the living process, especially people with terminal diagnosis, right? Because you do not know when they're going to go, right? But you have to anticipate that it's going to happen, all right? Then you also ask for available support system. What I mean by this is we have lots of NGOs, right? Communities that do this on voluntary basis, right? Cancer Society, patient support group, right? So these people can definitely help with the grieving, right? And the one that sometimes we forgot is about what are the legal problem, financial problem after all this death and grief that happens. Some people, the family member suddenly died, so they have lots of expenses to pay off, right? They have their lands or their houses to be diwasiatkan, right? So we can help in terms of assisting them. Of course, it's a more lawyer problem, right? But whatever you could do, assist, you can try to assist them, right? And you also try to identify high-risk family members who are prone to adaptation problem. This is normally kids, right? For example, kids, at the age of, teenagers, once they lost their loved ones, they certain age they understand, certain age they don't understand, right? And actually, if they understand, it could be good because, they know it's part of life, but at the same time, because they're still young, they do not know what is happening to them, whose fault is it, right? So it's maybe they can grow up becoming, a bit more emotional, right? Whereby the young ones, maybe if they don't really understand, you hope, they will remember all the things that happen, right? So in conclusion, I know this is quite lengthy. I've spoken so much already. Death is the end, all right? I mean, it's what we call the lost end. There's nothing beyond that. We can support, we listen, all right? We can make the patient comfortable as much as possible, all right? We can use our knowledge and expertise to prepare the family member, all right? And then you can also give effective care in terms of your listening, sharing your feelings, and then just being with them, right? So this is some of the examples of the references. I think that's about it. Thank you. I think it's a bit heavy for a Monday morning topic, right? It's more of finally, I think what we need to know is more of giving your ear and your heart to listen to the patient or the family members or whoever that is goes into grieving. Okay, thank you so much, guys. I need to stop sharing, right?
Okay, yeah.
Mm.
Thank you. May I call you Ibu Aini?
Yeah.
Okay. Yeah. Thank you, Ibu Aini, for your material. Very interesting. Oh yeah, everyone in here, if you have any question, yes, just feel free to ask to Dr. Aini. If you feel that you're in Indonesia, you can ask in Indonesia. It's okay. And in English also it's okay. Okay, we already have one question. Okay, wait. One question.
Oke, mohon maaf untuk bertanya, Ibu. Ibu tadi menjelaskan pada materi duka kronis yang berkepanjangan, dijelaskan bahwa kesedihan yang berkepanjangan adalah bersifat maladaptif. Nah, Mohon penjelasannya, Ibu, apakah yang dimaksud dengan maladaptif tersebut dan mungkin memberikan beberapa contohnya seperti itu. Terima kasih.
Okay, I think I missed out that maladaptive part of it. I think we can browse too. So because adaptive is a normal process of yang biasa, macam cara kita adaptasi, right? Tapi when it become maladaptive is something cara luar biasa, meaning that whatever apa yang patutnya kalau kita menangis, kalau macam kita bersedih, if you have grief, kita menangis kan biasa. Tapi ini kita tiba-tiba gelak ketawa, kita menyanyi ataupun kita membuat sesuatu yang things that different, right? Different than normal, right? This is because you can't cope, right? So that's part. That's how I understand it lah. The way that we use that behavior.
Are you clear? Okay, it's clear, Doctor. Okay, any other question, guys? Do you have any other question? No question? No? Okay, okay. While waiting on another question, Dr. Aini, I would like to maybe request to you to share about the palliative care in Malaysia a little bit, because you in previous slide you talk about NGO and volunteer, right? So who manage NGO and volunteer in Malaysia? I mean, like in here, it's not really clear even from a government or from hospital who manage the volunteer. Okay, maybe Dr. Aini, you can a little bit share about that. Thank you.
Okay, all right. Okay, as you know, in the hospital in Malaysia, we have either in private or in public practice. So we have a very good oncology cancer treatment group, right, all around Malaysia. So this is people that treats cancer to the max. But once it's no longer treatable, and then it's more of supportive, so they goes into the palliative care. We now even have palliative care as a specific entity, and we have specialists that is just for palliative care. So palliative care means that, how do you want to make the patient as much comfort as possible before they go. We do not know where to go, but we're not going to do the treatment that can make them worse, for example, giving them chemo, operation or whatnot. What we try to make them at ease as possible, right? Trying to give them pain management, trying to give them physiotherapy, try to give spiritual support, all right? And this is in the hospital basis, all right? Until then, even in some hospitals, they even have team of palliative care that goes to houses that has patient which is nearly dying, right? Now, that's the palliative care part. Now, so when you talk about the NGO, this and the palliative care are mostly under the hospitals, which is under the government or under the private entity. But the outside people, they can't depend just on the government, all right? So they have patients or family member of patient who sets up all this non-governmental organization to help specific people in specific types of mostly cancers, as I mentioned, right? So number one, we have a big one for breast cancers. We have multiple NGOs for breast cancer, all right? And then we have NGOs also for pediatric hematological, for all this leukemia and whatnot, childhood cancers. We have good support team from the colorectal cancers, all right? And most of them, because my experience is mostly towards cancer things, all right? And this group are actually headed by people which is not from hospitals, they are from the society, they are from the family, they are from even patient themselves who suffers it, right? So, and then they are totally their own entity, right? They get money from donations or whatnot, but they do provide help to patients in the hospital who needs that, right? We have example, we have NGOs who help to bring patients for follow-up in the hospital. They buy vans or car, no, mostly vans. So if the people they don't have transportation to go to the hospital, they can provide that free of charge.
Oh, oh, very nice. Free of charge.
That's why
So,
it's called NGO. I mean, like they are non-profitable. Maybe some are very minimal amount, but most of them they try to do it as a charity purpose.
okay, very nice. So yeah, they have a special NGO in like a pediatric and for cancer. Thank you, Dr. Aini, for your explanation about that. Do you have any other question, guys? Please feel free to ask. We still have maybe around 30 minutes. If you have any question. In Indonesia, it's okay. Okay. Okay, one student already asking me in my phone. She chat me and feel shy to asking directly to you, Dr. Aini. She asked about anticipatory loss. Yeah. In your previous explanation about anticipatory loss, so in this anticipatory loss, for example, in the cancer patient, how nurse help family members of cancer patient to cope with loss? So yeah, that is the question.
I can say this. I can say this in terms of my own personal experience with my friend. My friend just passed away 2 months ago because of advanced breast cancer. All right. We know because we know in advanced breast cancer where there are no more treatments, there are treatments, but the treatment might just prolong the life 1 or 2 months. All right. So we know this is going to happen. So, but we never accept that it's going to happen. No, it's not never accept. We don't want to think about it. You know, so we try to cope in terms of we try to enjoy the life with her as much as possible. We went for holiday together, you know, we went for outings, all right? We help her when she wants to, because she knows herself. And most of these patients, they know they know they're not gonna be in they know their life is short, right? So sometimes they need to get rid of some of their gold, their properties, right? And then for my friend, she was divorced, and then she wanted to give the custody of the son to the sister. So you assist them in terms of um 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 assist them in terms law wise, all right? Because if you don't assist in this, you don't assist that, meaning that you in denial that patient's going to go, isn't it? Because you said like, why do you need to change the custody? Kenapa you nak bagi anak you pada orang lain? Sebab you might not know you can leave, right? But we know that no, she's gonna go. But when is the problem? So actually that was the way that we friends, I mean, few of us cope with her loss. And now when we look back of what we did with her, you know, I think we should have done better. But we did lots of things that, you know, we never regret. We did that for her. So for example, but one thing that really saddens me is at the end of the day, she wanted to go for Umrah, but because she was stage 4, she can't walk. It was not feasible. I mean, actually, it's not. Actually, if you know, if you want it, kalau ada daya, ada upaya, ada kemahuan, actually can, you know, we can, you know, we can bring her on wheelchair, whatnot. But it wasn't feasible. I think that what really strikes us quite sadly, because she didn't have the last chance to go to Umrah.
Just the focus is to facilitate the patient to got the quality of life of the patient, right? So how about the family member, Dr. Aini? I mean that the family member will lose someone they love, of course. So how we help them to prepare the loss before the patient pass away? I mean, keluarga mempersiapkan diri bahwa pada akhirnya si pasien akan meninggal.
sometimes I think apa yang kita we if the patient or person still can talk, still can just ask what they want to say. I mean, what they want, try to make them as happy as possible. You know, if you have all this legal problem, maybe you have to settle it first. You know, even you have to get before it's just try to make them taste the last time of their life. You know what can make them at least okay. I've done this. I feel content. I feel better because I've done what I wanted to do. At least that I think that's part of the role of family members or friends. That's what I did with my friend as well, right? Except for the last part of the umrah, but and try to assist in terms of make the path is much more easier to them, you know, is because we had this issue once whereby the patient's dying, but the family member wanted to withdraw all the money from the bank, right, for the patient. So they literally had to wheelchair this patient, like nearly died, like a corpse, to the bank to withdraw the money, and it became very viral here. You know, I mean, how could you do that? You know, that kind of scenario, but it happens, right? So what I believe is we try to make the person satisfied with whatever they want in life, because then you as a family member, you as a friend, you feel you will not have the guilt that say, oh, I didn't have the chance to do that for that person.
Thank you, Dr. Ani, for your explanation. Okay, we have another question from Ibu Armenia. She is a nursing secretary study program. Okay, Bu Armenia, could you please open your microphone? Eric, could you please help?
Baik, Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Nice to meet you, Dr. Aini. My name is Armenia Diasari. My interest is pediatric nursing, Universitas Asia Yogyakarta. The material presented was very interesting for my student and teman-teman di sini. Because I interest pediatric nursing, how does to talk for children about death or grief, dokter, karena untuk berbicara kepada anak itu tentang death and grief itu very difficult, dan apalagi dengan kondisi sekarang itu banyak fenomena-fenomena yang anak dengan usia toddler sekolah itu dengan kehilangan anggota keluarganya. Mungkin itu, dokter. Terima kasih atas kesempatannya.
Yes, thank you.
Okay, thank you, Ibu Armenia. Yes, memang sememangnya untuk pediatric kanak-kanak, I don't have kids, you know. I know it's not fair for me to say this, but it's very difficult. You know, I have lots of nieces and nephews. You know, I know they are so precious, and all the pediatric patients. Then they have stages whereby they, like, you know, for the young ones, for 0 to 2 years old, they might not understand, you know, if they lost their loved ones. But there's the certain age where they only understand what's happening, and then they suddenly ask, where's their mother, where's their father, you know, where's their loved ones, right? This is difficult to address, definitely. You know, there's no hard and fast rule about telling them. But I think the most word that people always use, I think especially for us in Muslim, we always just say that Allah lebih sayang mereka, right? And then if you have a good information, or not information, if you have a good education, Islamic belief inculcate in them, we just say that, things happen, and then we advise them that, it's because of the greatness of God, Tuhan lebih sayang. I think their coping mechanism is better. And that's why I believe.
Oke, thank you Dr. Aini atas penjelasannya. Previously we went to Unimas to Aibnema sebelumnya bersama Bu Yuli, and di Unimas kita diskusi terkait dengan cancer dan to meet several resources about person cancer, dan beberapa memberikan motivasi kepada kita, apalagi yang terkait dengan pasien dengan cancer. Maybe one question again. There Malaysia, apakah ada kelompok usia untuk pediatrik untuk terkait dengan kelompok motivasi untuk palliative care untuk di Malaysia, dokter?
I'm not sure, saya kurang pasti. I don't, because in Malaysia, pediatric is age 12 and below, right? Most of his. So I think it's 12. Maybe there's that cut off age. How we divide our adult patients and a pediatric patient is mostly the cutoff is 12 years.
Terima kasih Dr. Aini atas penjelasannya. Cukup Bu Estriana.
Thank you Bu Armen. In here also Bu Juli Isnaini, Ibu. Last time also she went to Unimas together with Bu Armenia. Bu Yuli, maybe you would like to say something? Pak Erik, could you please help to unmute? Excuse me, Bu Aini, we are in technical problem. Bagaimana Pak Erik? Sudah? Oh ya, Bu Yuli, monggo Ibu.
Saya ya Mbak Estriana J.
Monggo Ibu.
Baik, terima kasih. Nice to meet you, Miss Aini Ibrahim. Let me in bahasa ya. Pemaparannya sangat bagus terkait dengan kanker di palliative care lah in Malaysia. Pertanyaan saya adalah bagaimana atau kebijakan apa yang ada di pemerintahan Malaysia terkait dengan pasien-pasien atau penduduk yang mengalami cancer. Apakah ada kebijakan khusus yang kemudian mulai dari preventif, promosi dan pencegahan serta kurasi ataupun rehabilitasi. Terima kasih.
Terima kasih Ibu Yuli. Kami di sini bergantung kepada jenis-jenis penyakit dan kansernya. Jadi yang the most one that we have is for the breast cancer, because in Malaysia, in terms of in the whole of Malaysia, we have this good screening program. So this is via mammogram, which is given free of charge to the people, the women aged 40 and above, so they can go to all these specific hospitals to get mammogram, and then if it's positive, they can be referred to have a further management. For breast cancer, is quite one of the most well known. Plus, they have a good support team, good the patient support group. We have lots of breast surgeon here. The incidence of breast cancer is becoming less here because of the good preventive or screening program. Then number two, we have the second most common one is colorectal cancer, but unfortunately we don't have the screening method yet. It's not used throughout yet, but mostly in the clinic setting, which is like the puskesmas, I think, in Indonesia. So if pesakit atau patient ada symptoms, then we do the screening. But if not, still colorectal cancer is still a new thing here. We still have to have more informations being programs to have the awareness in comparison to breast cancer.
Terima kasih, Ibu Aini.
Thank you, Ibu Yuli dan Bu Aini. Okay, maybe for the last question, Dr. Aini, could you please explain a little bit what is the effect of culture in the palliative care in Malaysia? Before, in the previous slide, you talk about the sign of grieving in the denial until acceptance. So one of them is maybe crying. So in here, in Japanese culture, especially we have culture like laki-laki tak boleh menangis. Seperti itu, macam tuh. Nah, could you please little bit share about that? Thank you.
Okay, so especially towards the end of the life care of the patients, right? Because we have the majority people here are either the Malays, the Chinese, the local tribes, and the Indians. So or even the Christians, right? So most of them will have different methods of coping and going through the loss. In the Muslim society, the Malays, towards the end, they want to bring their family member home. They want to bring the patient home, and then sometimes they will try alternative treatment too. But at the end of the day, they want to be in the area whereby they have all this. They can recite all the dua. They can do all this, the prayers next to the patient, right? Whereby if I have in terms of the Chinese society, they believe that death at home is what do you call that? Not tak berkat lah. It's what do you call that? Black meaning that they don't want the anybody to die at home. Meaning that's it's I can't remember the word. Sorry. It's basically it's bad luck. Sorry. Bad luck for the anybody to die at home. So they will just either they let the patient die in the hospital, and then later on go for cremation or burial, and then have and do all the normal religious things. All right. The local tribes people depends on the religion. Most of them are Christians. Again, they are more acceptance as well, because they accept this is part of their life, right? And we do have people from the Indians. Indians are much more grievous in terms that they have to cry to show that they are in grief, right? So they really, sometimes they even paid people to cry and whatnot. But in saying that, I think even now it changes in terms of the modern family. It's all go back to emotional of the person. But Those are what we see here.
Thank you, Dr. Aini. In here also, in the community, usually the neighborhood, I mean, they think that if the family not bring the patient to go to hospital, it's very bad. But actually, in palliative theory, they said that the family would like to die in near with the family, like at home, something like that. In Malaysia, also you have kind of the culture like that, Dr. Aini.
So what do they want?
In here, in Japanese actually, especially when the patient got sick,
Mm.
in palliative patient, the neighborhood will say bad if the family member does not bring the patient go to hospital. Because usually the palliative patient would like to die at home with the family member.
Mm. Yeah. Mm.
This kind of culture also.
Um, we do, but I think most Malaysians now, they are, in terms of they understand, the hospital will give provide the basic care of as much as possible, right? Unless the hospital say to them, look, we have nothing more to offer. Yes, maybe you should bring them home, right? But normally people will, yeah, I'm sure there are people who just stays at home. They say, like, there's no point of going. They just want to die peacefully. Yes, they are, but um, I'm not sure how many in terms of those who goes to hospitals or those who stays at home. I'm not too sure. But we do have that kind of people who just wait at home.
Yeah, I think just same. Yeah, yeah.
Mm.
Similar culture.
Mm.
Thank you, Dr. Aini, for your very nice explanation, and you also willing to share about the Malaysian palliative care in Malaysia. And I think now we'll hold and we will hold of photo session before we close the class for today's activity. Yeah, excuse me because our internet connection is not really good this afternoon. I don't know why. We are waiting for the technical staff to. Okay, everything is clear. Okay, thank you. Yeah, yeah. Before we close, we will hold the photo session first. Pak Eric, could you please help for the photo session? Pak Eric, could you please dipinkan untuk foto session? Oh, dari sini. Dipinkan di tengah kayak gitu loh. Hah? Oh, dari sini. So sorry. Ya, ya. Pak Eric will help to pin. Okay, Bu Aini, so sorry for the technical error. So we are waiting for Pak Eric to make a pin for you, Yuli, and the participant in here. Yes. Yes. Yeah. 1, 1, 2, 3. Okay. Finish, Pak Erik? Okay. Yeah. Thank you, everyone. Thank you, Bu Aini, for the very interesting material, and also to all lecturer as well as participant in here. We would like to say thank you. And we already have a photo together to perpetuate for our activities today. I would like to say thank you to you all that contribute to this event. I also sincerely apologize for any shortcomings and mistaken. And let's close the activity by reciting Hamdalah together. Alhamdulillahirabbil alamin. I wish you all a pleasant day. Thank you. Wassalamualaikum warahmatullahi wabarakatuh. Thank you so much, Bu Aini, for the class.
Thank you.
I will contact you by WA and also email for the another document that we have to finish them. Thank you so much. Nice to meet you, and hopefully we can see each other in another time. Thank you. Teman-teman jangan lupa resumenya dikumpulkan di meja saya ya. Urut kelas A, B, C, D. A, B, C, D. Sebelum meninggalkan ruangan. Dan juga presensi. Tolong ya dibedakan. Sebelah sini kelas A, B, C, D ya. Jadi sebelah sini A. A, B, C, D. Jangan kecampur. Jangan kecampur. Silahkan keluar urut tidak gerudukan. Urut dari depan. Urut dari depan. Presensi jangan lupa diletakkan. Urut dari depan sini Mbak. Kelasnya apa? A, taruh sini. Nah enak kan duduk di depan? Paling akhir belakang ya. Oke, boleh langsung keluar. Siapa suruh di belakang? Yuk, boleh Mbak langsung keluar. Absen belum? Kelas apa? Siapa yang pegang absen sekarang? Boleh maju, tolong diserahkan di paling depan sini, di meja saya. Tolong diserahkan di paling depan di meja saya, semua ya. A, B, C, D, absen A, B, C, D. Keluarnya gantian ya, jangan